Yeah, here we go. Yeah, I'm being censored here. Thank you. But I will tell you, the experience that really made me decide that I was on the wrong side. I was back in Tennessee visiting my parents, and I picked up my hometown newspaper, and I read about something called a healthcare expedition that was being held a few miles from where I grew up. And I noticed that the organizers was this group called Remote Area Medical, and it was started several years ago to fly doctors from the U.S. to the Amazon and to Africa to take doctors there to provide free medical care to people who didn't have access to care at all. Well, this organization realized pretty quickly that we have a great and growing need in this country to provide care to our own people. I hate to admit this, but in my corporate job in a skyscraper in Philadelphia, I just had let myself become removed from the reality of what happens in so many people's lives. But this experience brought it home to me. This expedition was being held at a county fairgrounds in Wise County, Virginia, in the southwestern part of the state in the southern Appalachians. I walked through the fairground gates and was just absolutely stunned at what I saw. It was a life-changing experience. It was truly my road to Damascus experience. I saw hundreds, actually thousands of people who were standing in line to get care that was being provided by doctors who were providing their time over a 3-day period of time. People were standing in line in the rain. Many of them had slept in their cars. Many of them had driven from Ohio and West Virginia, Kentucky, Tennessee, South Carolina, Georgia. They had waited in line, had gotten up before dawn to stand in line to get a number so that they could be assured of getting inside the fairground gates. Once inside there, they had to stand in other long lines to get care that was being provided in animal stalls and in barns. And it was more than I could bear. It brought it home to me what happens to so many people. And I learned that a lot of those people had insurance. They were in the kinds of plans that I spoke about. The kinds of plans that the insurance companies want to move us all into so that we all will be underinsured. 25 million of us are there already. If they get their way with the legislation in Washington, we'll all be there, folks. We'll all be there.
Single payer now.
They want to move us there, so they won't have to pay for our care when we need it, because that means they will be able to send more of your premium dollars to shareholders. Since 1993, the amount of money that we pay in premiums that's used to pay for medical care has dropped from 95 cents to about 80 cents a day. That has happened as 3 things have happened. Our health insurance companies that we used to think of as nonprofit organizations have converted rapidly to for-profit organizations. There's been a great consolidation in the industry. 1 out of every 3 of us that has insurance is enrolled in a healthcare plan managed by just 7 of the largest for-profit insurance companies, 2 of which I used to work for, Cigna and Humana. So they have grown into a cartel of big health insurance companies. And they pretty much control what goes on in Washington, to tell you the truth, and to be very blunt with you. But there's also been something else. There's been concentration in the marketplace. We do not have the kinds of choices that they think that we do, or we think that we do. Yes, single payer is the ultimate answer, but we need some solutions right now. We need to get what we can get. And I hope that we'll all understand that it's not perfect, but it is something that is going in the right direction. And I know from talking to many members of Congress that they want to do the right thing. Many of them do. Obviously, many of them are bought and paid for by the insurance industry and other special interests.
That's right.
But there are more, fortunately this time, I think, that really want to do the right thing for their constituents. And that's what I've been trying to do, is to make sure also that they understand that one of the tactics of the insurance industry is to try to beat us down, to try to get us discouraged, to try to think that it's not worth fighting for. It's not going to happen. A public option cannot pass. That is part of the strategy. It can pass, and I believe it can be beneficial. And I'm hopeful that what legislation the President signed will include a public option that will help people who don't have insurance, help people who are underinsured. Now, the president did say in his joint session to Congress a few weeks ago that he would like to be the last president to deal with this issue. He's not going to be, folks. That legislation might help some, but it's not going to be the ultimate solution to what we need. He said he wanted to have a healthcare system in which not one of us will have to be forced into bankruptcy because of medical bills or have to move out of our homes because of foreclosure. Sadly, the bills that are working through Congress, that's not going to fix that problem. We're going to see that continue. It may help, but it's not going to be the solution. So that is why my hat is off to you guys for doing what is the best work to get us to the solution that we ultimately need. We need, though, as this debate winds down and something happens in Washington, to really regroup and redouble efforts here to figure out and do a post-mortem of what happened this time. What happened to make it impossible for single payer to be considered in the first place seriously in Washington. Why is that? Yeah, we need to understand exactly what happened. Analyze that. Take pages out of their opponents' playbooks. Know how they've been successful every time. Form coalitions with strange bedfellows. Talk in the language that people understand, and people hear different things. Talk to some people in ways that connect with them emotionally. Use terms that are responsive or as powerful as the opposition's language, like a government-run healthcare system or government take over the healthcare system. We need to have language that means something to people and gets them to understand what we are really trying to do here and why we need to do it. And we need to get people who are young to understand why we're doing this. I said earlier that I'm doing this ultimately for our kids. I did not want them to be among the people who might wind up getting care in an animal stall. And I don't want any of you or any of your children or grandchildren to be there either. So we've got to make sure that doesn't happen. We've got to spread the word. We've got to be well organized. We've got to figure out how to communicate better. And we've got to make sure that young people understand the implications for them of not taking action. Get them involved. Get them to own this. And get them to understand why we're doing this not for ourselves, not because we're getting paid a lot of money to do this, but we're doing this for them, for their future. And also talk to people about the economics of what we're trying to do here. Some people, like I said, understand what we're trying to do from an emotional point of view. Others can be more persuaded if we talk about the economics of this. And when I talk about young people, a lot of people, as they get into the job market, they might get a job, they have benefits, but they're scared to death. Many of us already are there, of leaving that, of being entrepreneurs, of starting your own businesses, because we're locked into that job. And also we need to make sure people understand that almost every one of us is just a layoff away from being in the uninsured. And we're just a strategy change from being in the underinsured. Folks, I'm going to wind up. Sorry I've taken up so much time. And we really are, as Chuck said, at ground zero here. This is just a phenomenal thing. I'm so glad I'm here and not in a corporate staff meeting and not in a committee meeting. This is the beginning of a movement. I'm so proud to be a part of it, and you can count on me to be there with you. Thank you very much.